Have you ever worried about a medical test result, wondering if it truly captured the full picture of your health? It is natural to feel uncertain sometimes, especially with tests for serious conditions. Understanding the nuances of these tests can bring a lot of peace of mind. When it comes to tuberculosis testing, it is important to know that yes, a tuberculosis test can indeed produce a false negative result. This means that a person might actually have tuberculosis infection, but their test result comes back showing no infection. It is a critical piece of information because an undetected infection could lead to progression of the disease or transmission to others. The why behind a false negative result often lies in the intricate dance between your immune system and the test itself. One common reason is what doctors call the window period. If someone has very recently been exposed to tuberculosis bacteria, their body may not have had enough time to develop an immune response that the test can detect. Another significant factor is a weakened immune system. Conditions like HIV infection, diabetes, or taking certain medications that suppress immunity can prevent the body from reacting strongly enough to the test antigen. This is particularly relevant for the tuberculin skin test, where the body's reaction, or lack thereof, directly determines the result. In some rare cases, a person with very advanced active tuberculosis disease might also have a false negative because their immune system is overwhelmed and cannot mount an effective response. There can also be technical issues, such as the test not being administered or read correctly. So, what should you do if you have concerns about a potential false negative? The most important step is to communicate openly with your healthcare provider. If you have had a known exposure to someone with tuberculosis, or if you are experiencing symptoms consistent with the disease like a persistent cough, fever, unexplained weight loss, or night sweats, even with a negative test, discuss these concerns thoroughly. Your doctor might recommend repeat testing after a certain period, or suggest a different type of test. For instance, if you had a tuberculin skin test, they might consider an interferon gamma releases assay, often called an IGRA test, or vice versa, as these tests detect different aspects of the immune response. In some situations, a chest X-ray or sputum test could be necessary, especially if active tuberculosis is suspected. An interesting insider term you might hear is anergy. This refers to the body's inability to react to the tuberculin skin test, even when tuberculosis infection is present, precisely because of a compromised immune system. This concept highlights why a doctor's clinical judgment, which combines your medical history, symptoms, and risk factors with test results, is so incredibly valuable. It is not just about a single test result, but the whole picture. Both the tuberculin skin test and the interferon gamma releases assays are tools, but they need proper interpretation within your unique health context. Understanding that a tuberculosis test can sometimes yield a false negative empowers you to be a proactive partner in your health care. By knowing the factors that can lead to these results and maintaining open communication with your doctor, you ensure that any potential tuberculosis infection is accurately identified. This helps protect your health and the health of those around you, allowing for timely and effective treatment if needed.